Imagine having hundreds of tiny tumors all over your body and only hearing these words. Nothing can be done about it. For Brandy, we were her last resort.
About 2 years ago, I just started noticing these bumps on my skin. I first noticed them on my armpits, then they started multiplying. They started slowly moving up my arm, on my neck, on my chin right now, genital areas. They keep coming, and then they started getting darker.
Seeing my daughter live with this every day, it's been painful. She's so isolated. Mom, Dad are the only friends that she has right now.
Back in high school, I used to date, but now it makes it difficult because I feel like they're not gonna wanna be with me over a skin condition.
She's only 19.
I went to see 3 different dermatologists and they had no clue what to do. Wearing bathing suits and tank tops is really difficult. And I don't feel normal because I see other girls and they have the perfect skin and they can like lift up their arms and they don't have no worries at all. And then I have all these bumps all over my skin.
You said that you've had these a couple of years now. Do these bumps hurt you? Are they painful?
Nothing painful.
They're bump up over the skin, but they're also under the skin too. Let's take a good look at this. This is rarer. How we describe these are these tan or fawn colored papules that are clustered in this area. They're all the same size and shape and color. Really essentially benign appearing. A biopsy will help to confirm our diagnosis. What is so frustrating and scary for you is that the fact that they come up so quickly, kind of worried like, what is this? There's something wrong with me, and you feel out of control. I think we have some ideas of what to do. Let's see if we can make the appearance of these better and make you feel more confident.
Brandy and Dr. Lee join us now in our exam room with Dr. Orden.
Welcome. Kind of hard to watch that, isn't it?
Yeah, it's a little difficult.
So what did the biopsies show?
Well, it did confirm that she has syringomas, that you have syringomas. And, you know, typically we see syringomas under the eyes. That's where we most commonly see it. You have a little bit of a rarer form called eruptive syringomas, where you get these kinds of bumps in crops, really in our torso area, you know, our armpit, our abdomen, around our belly button, our neck, genital area, that kind of thing. The good news is that it's benign, nothing life-threatening. Yes, that's really good news. Wonderful news. The not-so-great news is we don't have a way to stop them from happening, although I don't think that this is something that's going to just keep happening. It usually sort of peters off eventually, and sometimes it actually spontaneously regresses. But there are different methods that we can use to try to improve them. So we're going to try a couple other ways, okay? Number one, if you want to hold your arm up, I'm going to use, so all these methods are all kind of trying to take that surface off, okay? One would be a chemical peel acid using trichloroacetic acid. It's 35% chemical peel. It's a medium depth chemical peel. We use it oftentimes. Cosmetic surgeons, plastic surgeons, dermatologists use it for chemical peel, wrinkling, brown spots. But I'm going to paint it on one of these spots, okay? So this one spot here, I'm going to put TCA on, trichloroacetic acid. It's going to frost over the next few minutes, and then over the next week, it's going to peel off, okay? The next method I'm going to use is liquid nitrogen. This is something that is really the bread and butter in dermatologist offices. We use it for warts and various other treatments. I'm going to use a cold spray here. It's really cold, okay? And what I'm doing is I'm inducing frostbite in this area. It's going to make it turn darker as well in this area, and that area will fall off in the next week. So let's see how that does. Lastly, I'm going to use an electrocautery. This actually is a desiccator, or it burns the superficial skin. You know, these are really superficial, as we can see, and I'm just trying to, I put a little numbing on this one.
So Dr. Lee, after you do all these treatments, how long are you going to let her heal before you bring her back to see which one worked the best?
I'm going to let her heal because it's going to take about a week for these to peel off. And I'm going to see her probably, I would love to see you in 2 weeks from now and see how these all heal, compare them. You're going to know which ones we treated in which way. And let's try to find the best method because I want to work with you to find the best way to make these look better and have you be confident, okay? Thank you.
We're so happy for you. You're in great hands, trust me.
Thank you so much.
And I think this reminds all of us, when you hear the words or the phrase, nothing can be done, it's only in very rare circumstances where nothing truly can be done.